Hello viewers, welcome to Nursing Tutorials with Jamila. This is another great opportunity for us to learn from each other. Today we are going to be looking at inflammation. Inflammation is usually a local response by the body tissue to an injury. So it is usually triggered by a living tissue. And it is a defensive mechanism that usually involves in higher organisms to protect them from infection or to protect them from an injury. Now, inflammation, it's usually for a purpose of localizing and then eliminating the injurious agent to remove the damaged tissue components so that the body can begin to heal up. All right. So it's mainly for localizing and eliminating the injurious agent from the body tissue so that healing can take place. Now, the response usually consists of changes in the blood flow. So in inflammation, there is usually change in blood flow. Actually, what happens when there is a physical trauma to the body and then the body tissue is trying to fight it, is trying to eliminate the cause to restore back the tissue, there is usually increase in the blood flow to that area. And there is the increase in permeability of the blood vessel and the migration of fluid, proteins, and white blood cells, especially the leukocytes, from the circulation to the site of the tissue damage. Now, the inflammatory response usually lasts only a few days. That is the acute inflammatory response. We are going to look at the signs of inflammation. There's usually 5 cardinal signs of inflammation. We have a redness. Now, the redness is usually as a result of the increased blood flow to the area. Then we have heat. And then the heat is also as a result of increased blood flow through the area and is experienced also only in the peripheral part of the body. That is the skin. That is where the heat is experienced. Then there is also fever, which is brought about by the chemical mediators of inflammation, and they contribute to the rise in body temperature at the injury site. Then there is also edema as a cardinal sign. There is edema at the site of the injury. Now, this edema is caused by accumulation of fluid outside of the blood vessels. Okay, so the fluid escaped from the blood vessels and it entered into the ECF, that is the extracellular fluid compartment, and that's what results to the edema. Then there is also pain as a cardinal sign, and this pain is associated with inflammation, which results in part from the distortion of the tissue that is caused by the edema. So when there is edema, there is usually exertion or pressure on the sensory nerves endings, okay? And this is what usually results to the pain. Then there is also loss of body function, okay? So the parts that is affected, you see that it's usually minimized. It's not usually involved in activities because of the pain or even as a result of the edema. Now, the pain also can result as a result of the presence of the chemical mediators of inflammation, that is bradykinins, the serotonins, and then the prostaglandins. Now, these chemical mediators can also cause the pain. So this is pertaining the sign and symptoms of inflammation. Let's look at the causes then. What are the causes of inflammation? Now, the causes of inflammation, it usually results from physical agents such as heat, cold, radiations, even pressure from substances, okay, can result to inflammation. Then chemical agents such as acid, alkaline, or even cyanides, all right, when an acid poured on the tissue, it can result to inflammation. Then infection such as bacterial infection, viral infection, fungal infection, or parasitic infection. So when there is activities of bacteria in a particular tissue, the body tissue tend to respond to that activity. It results in inflammation. Immunological agent also can cause inflammation. Immunological agents such as cell-mediated and antigen antibody reactions can result to inflammation. Foreign bodies can also cause inflammation. For example, sutures. When a suture is applied to the tissue try to fight it because it is a foreign body. So it tries to fight it, and that results to inflammation. So these are the causes of inflammation. Then inflammation also is divided into two main types. We have the acute. Now the acute inflammation is usually short in duration, and it can last from like up to 2 or 3 days in duration. Then the chronic is usually the type that lasts for a longer period, lasting 6 weeks or even longer than that. So this is it pertaining the inflammation. So in the next video, we'll be looking at the different types, that is the acute and the chronic inflammation. Thank you very much. Hope you enjoy it. If you like this video, please don't forget to like and subscribe. Thank you.